bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
African Americans are twice as likely to suffer a stroke, and we'll talk about why next. Hello again, and thanks for joining us. I'm Jen Boyette, and this is Comcast Newsmakers. With me today is Dr. Lee Kirksey. He's the president of the Philadelphia Peripheral Arterial Disease Prevention Coalition, and today we're talking about stroke prevention. So nice to have you with us today.
Thanks, Jen.
So those numbers might be alarming to people listening out there who didn't know that they might be twice as likely to suffer a stroke.
Absolutely. I think the numbers are alarming, and they should be alarming. The major point that I'll make is that stroke is preventable. And if we can just identify risk factors in certain groups of people, then we can identify this process early and prevent a person from having a stroke.
Okay. What exactly are those risk factors that people should be aware of that they might be prone to having a stroke?
Well, there's a list of risk factors: age greater than 65, diabetes, high cholesterol. A person who smokes is at greater risk for having a stroke. African Americans are at greater risk for having a stroke, as you described. And being overweight, that's another risk factor for stroke.
Okay, and in African Americans, high blood pressure seems to be more typical with them as well. Is that true?
That's entirely correct. 1 out of 3 African Americans have high blood pressure, and that's one significant cause of stroke.
Okay, and everything you mentioned, though, are things that if you know it's a problem for you, can be maintained.
Absolutely, absolutely. High blood pressure doesn't develop overnight. It develops over a period of time. High cholesterol and fatty deposits within the blood vessels that cause blockages, that's a chronic process over a period of time. So if we can identify that process early, then we can treat that aggressively.
Okay, is it always medication, or is it things like diet and exercise that people hear all the time but sometimes aren't willing to do?
The first line of treatment is lifestyle changes, behavioral changes, diet, exercise, eating a low-fat diet, smoking cessation. That is the most important thing you can do. If a person stops smoking, they can decrease their risk of having a stroke or heart attack significantly.
Okay, tell us exactly what a stroke is and what it does to you so that people understand the importance of preventing it.
Sure. 2 types of strokes, one caused by high blood pressure, another caused by blockages in the blood vessel. Both affect the circulation of the brain. And so when people have a stroke, they can be disabled where one of the signs is having difficulty moving one side of your body. They can have speech disturbances, difficulty forming words. They can also have vision changes and lose their vision.
Right. And sometimes it's not something that makes you outright collapse. You could suffer a stroke and have it be semi-mild and not notice it for a few days. Right. So what do people do in those cases? What should they be keeping an eye out for?
I think when you have what's typified called a minor stroke, a mini stroke, it's important to call your physician, describe those symptoms, but even more importantly, before waiting for something to resolve, get to the emergency department, seek medical help.
Right, because the longer it goes unnoticed, the more trouble it's causing.
The longer it goes unnoticed, the more trouble it's causing. 750,000 Americans have a stroke each year. Only 1/2 of those people have symptoms. 50% have symptoms before the stroke. So most people are going along just fine with their high blood pressure or their high cholesterol, and all of a sudden they have a stroke with no preceding symptoms.
Okay, and I know you already mentioned the age range there of 65, but it does happen in younger people.
It happens in younger people as well. So if you're a younger person, if you're in your 50s and you have one of these risk factors, diabetes, high cholesterol, if you smoke, you are at higher risk for stroke, and you should be monitored more closely and undergo the appropriate testing.
Mm-hmm. Are there certain medications that can do it to you? Because I had a friend back in college who was on birth control, and she suffered a stroke at, I think it was 22 or 23 years old.
Sure, certain medications can cause you to have a higher risk of developing blockages within the blood vessels, and oral contraceptives are one of those medications.
Okay, but the key that we always say is early prevention, know what your risks are so that you can just be aware of it.
Absolutely, that's very important.
Okay, wonderful information. Thanks so much for being with us today.
Thanks, Jen.
And thanks for watching. This hour's newsmaker has been Dr. Lee Kirksey. He's the president of the Philadelphia Peripheral Arterial Disease Prevention Coalition. And I'm Jen Boyette for Newsmakers, an exclusive production of Comcast.